waste what's left. The storms we chase are leading us, and love is all we'll ever trust.
This session is regarding the revision of immunology practicals, but this is not, don't take it for granted, this is not going to cover you all the things, okay? This is a revision, that is a brainstorming session. This will give an idea, that is, it is going to be briefing everything, but unless or until what I have taught, you have not referred, you are not going to understand anything, okay? Take this as a brainstorming thing, that is, to make it easier, I have put all the 7 practicals in one chart, okay? Those who are not able to understand, they can understand from this, but at the same time, it is required for you to study from the chapters what I have given to you, as well as your self-study. Unless or until you do the self-study, you are not able to understand the auspiciations, and reading the questions are must. If you are not able to understand the question, whatever you have read is going to go in vain. Okay? Let us, without wasting any time, let us begin the class. Immunology, that is the immune system, is dependent upon 2 components. In all the practicals, you can come across the 2 components are antigens and the antibodies. Either an antigen or an antibody should be specific. If the antigen is specific, the antibody is unknown. And if the antibody is specific, the antigen is unknown. This concept, you have to keep it in your brain. Unless or until you keep this phenomena, you will not going to understand any of the practical sessions. To begin with, we are beginning with the agglutination technique, in which we are going to see first is the slide agglutination test. Here in the slide agglutination test, there are divided into 3 categories. The first one is direct agglutination, passive agglutination, and co-agglutination. Okay, and all this is called slide agglutination because we are going to perform it in the slide. Direct agglutination. The example for that is blood grouping. Here, this is one of the most simple and easiest method of performing the agglutination test. Here, you are going to take the specific antigen or the specific antibody and you are going to mix it with the unknown sample. Okay, example, blood grouping. You can see this one. Okay, this will be the spotter for your exam. The second concept is passive agglutination. Here also the antigen and antibody complex are formed, but here we are using the latex coated particle as the inert particle. That is either the antigens are coated with the inert particles, and it is the latex, and it is in the white color substance. Okay, you can see the result. This is the negative result and this is the positive result. The positive result will show granular agglutination reactions. Okay, and here this is the example for ASO, CRP, RF, and toxoplasmosis. What is ASO? Anti-streptolysine O. When you have the streptococcal infections, you can find this. This is the C-reactive protein, and this is the rheumatoid factors for the joints, and this toxoplasmosis, of course, you should know it is for the cats. And you should know that all the questions will come in the form of the case scenarios, so that you should know the background of all the things. The third one is co-agglutination. This one is not in the form of a specimen, it is going to be in the form of a picture. The picture is already there in your tutorial or the materials what I have given to you. Okay, here the inert particles in the form of Staph aureus is being used. Here the Covine strain of Staph aureus is being used. Here also you can see the agglutination and no agglutination. And this type of test is performed for the Streptococcus pneumoniae and Neisseria meningitis. Okay, and if this question is related mostly to the CSF as well as the nosocomial infection. The next test what we are going to perform is the Widal test, and this is the tube agglutination test. And this tube agglutination Widal test has been done for the Salmonella typhi, and this is for the enteric fever. Please remember, Salmonella typhi depends upon the enteric fever. Okay, and it is performed in the form of the titration method, that is the samples are serially diluted and you have to see the agglutination till the last tube where it shows. Okay, and it is in the set of OH and AH and BH. Okay, O antigens are called as the somatic antigens. H antigens are called as the flagellar antigens. The H antigens are further divided into AH and BH. Okay, here you have to see that the agglutination with the O antigens will be in the form of granular okay, and it will be in the bottom of the test tube. You have to see it is like a chalky appearance, okay, and you have to see till the last tube with agglutination, and that is the titer value. If it is for H, AH or BH, it is in the form of loose cottony appearance, okay, and here also you have to see the agglutination till the last tube. So you have to see each and every step, and you have to take the titration value for all these things. Then you have to compare it with the significant value. What is the significant value? This is the standard value for which you have to compare. If the sample you are getting, the titer value is 1:160 or above, 1:160 or above, it is considered significant. Anything less than that is considered normal, okay? And besides that, you have to interpret the result. If you have got the value of 160 and above for O antigens, that means it is the recent acute infections with the Salmonella typhi. If it is for the H, that means it is the past infection or the chronic infection or immunization with Salmonella typhi. The paratyphi scenario comes only if there is an agglutination with A or B. Okay, please remember, if there is an agglutination with H, you have to check with AH and BH. Either one of these two will be positive or maybe negative. If either one of these two is positive, that means it is paratyphi. But if it is not that one, you have to just report it for the Salmonella typhi. The next test is Coombs test, and this is done for the incomplete antibodies which do not agglutinate with the antigens. Okay, for this we are going to use the Coombs reagent. In the exam, you have to know, okay, the direct Coombs test and indirect Coombs test, and the principle of the direct as well as indirect. It is very simple. I have made it very simple for you. Sensitization of RBC. Sensitization of RBC, if it happens in vivo, it is called as direct. Sensitization of RBC, which happens in vitro, is called as indirect. Okay, here also you are going to see the agglutination. Here we are going to give either one of the two tubes. Okay, this tube on my right hand side is the agglutination, which is a positive reaction. You can see at the bottom the agglutination has taken place, and here, okay, this is the negative one, and this is the negative for both direct as well as indirect, and this is the positive for both direct and indirect. Okay, so you have to mention it, this has agglutination. This will be given as only one tube. We will not provide two tubes, either this or this. Okay, and how to identify this as a Coombs, which type of Coombs test, is based upon the scenarios. The three scenarios I have given for the direct as well as the three scenarios I have given for the indirect. Anything regarding the reactions, anything regarding the reactions, it is for the direct. Okay, anything which has to be done pre, that is before performing, introducing anything, it is indirect. For example, here, erythroblastosis fetalis, drug-induced transfusion reactions, okay, or any other things related to the autoimmune disorders, it is direct. And here, okay, if it is done for the mother, if the Rh negative fetus is there in the mother and the prenatal test has to be done, it is indirect. Before the transfusion of the blood, indirect. And even for the abortion of Rh negative fetus, it is done in the indirect Coombs test. Okay, and you should know what is a Coombs reagent also. What is the reagent we are adding? Here we are adding the Coombs reagent. If the question is asked, what is the reagent used, or what is the Coombs reagent used? Okay, sometimes they will not give the name Coombs, because if we do Coombs, no further in asking the questions. What is the reagent used? Here in this scenario, you have to write it is anti-human immunoglobulin. Understand? So this is how you have to approach. Please remember, only one tube will be given, and the agglutination will be in the reddish dot, and no agglutination will be in the red color substance. Okay. It's not possible. We go for the precipitation reactions. Here, the soluble antigens and the soluble antigen bodies were mixed together to see the agglutination reactions or the precipitation reactions, what you call. Here, the precipitation reactions are divided into two types. One is solution, another is in the gel. Precipitation in solution or precipitation in gel. Here, precipitation in solution, we are going to see three examples is Ascoli ring test, VDRL, and capsule swelling test. Ascoli ring test, this is done for the anthrax. Okay, this is done for the Bacillus anthracis. Mostly this is the zoonotic disease. Okay, and here you also have to know that what is a post-zone, pro-zone phenomena, and equal, that is a zone of equal. Okay, what is pro-zone? Pro-zone means zone where the antibodies are excess. Post-zone where the antigens are excess. Zone of equivalence is the zone where you have the antigens and antibodies in the equal number and it will form a ring. That's why it is called as a ring test, but in the exam you have to write it is an Ascoli ring test. Okay, and what is the type? Precipitation in solution and all these things. Next, okay, regarding this Ascoli test, this is the spotter, what you are going to get it. The next one we are going to discuss is the VDRL test, and this is done for the syphilis. You have to remember that syphilis is caused by Treponema pallidum and this is a sexually transmitted disease. Okay, and here what is the type of this reaction? Is the precipitation in solution. But if they ask what is the principle of this test, you have to write that it is the flocculation method, flocculation test. And the specimen for this is this slide. Okay, this slide will be provided for your exam and this is for the VDRL test. Now, third category is capsule swelling. The capsule swelling, we are not having the specimen, we are going to give it in the form of a picture. Okay, this reaction is otherwise called as Coulomb's reaction. Here what happens, this is especially done for the Streptococcus pneumoniae. Actually the Streptococcus pneumoniae has the capsule for which if there is a capsule is swelling, you know that method of precipitation, when the capsule swells it is a positive and if the swell it is negative. This question will be based upon the nosocomial infection because hospital-borne infections, especially for the patients with the surgery or elderly persons or the infants or the children, they are main cause of this one. Okay. Moving on from this, we go for the gel, that is the precipitation in gel. This is of three categories: radial immunodiffusion, Octoloni method, and the LX. Radial immunodiffusion is otherwise called as single diffusion, and this is mostly done for the concentration of either an antigen or an antibody. If suppose we wanted to know the concentration of an antibody, what we take is, we take an agarose gel, okay, which is being incorporated with the antigen, and we make several wells and we put the different concentrations of the antibodies. The highest zone, that is the zone formation, just like an antibiotic sensitivity, the biggest zone refers that the concentration of the antibody is higher, okay, and it is affiliated to that, okay, and that's why it is called single diffusion. And this is also in the form of picture, it is not going to be in the form of a specimen. The second is Octoloni method. This Octoloni method is called as a double diffusion. Okay, here what is the, why it is called double diffusion is, the antibody is subjected to two antigens. Instead of one antigen, we are going to see two antigens, and this is also going to be in the form of a picture. Okay, and here you can see the line formation, spur formation. This is called band or the spur formation. Here you are going to differentiate into three categories, that is the identity, partial identity, and no identity. If there is an identity, the two spurs will be in the form of a curve. If it is a partial identity, one will pass through this and it will form in like an arc. The third one is, it will make a cross. Cross means no identity at all. And you have to know the examples of this and this, okay? And this is called the self-study, okay? I already have discussed in the class, it is for the IgM, all these things, but still you have to know all the details. The third one is LX test, and this is going to be in the form of a plate. This plate is the agarose plate, okay, and here you are going to, you can focus this. This is the LX plate, okay, and this LX test is done for the toxigenicity of Corynebacterium diphtheriae. Okay, this is done only for the Corynebacterium diphtheriae, which causes diphtheria. Here in this plate you can see the positive control and the negative control. Okay, the positive control will have the line formations and the negative control will not have the line formation. The strip what you are seeing in the middle is the LX strip, and the middle part is the LX test. That is, this test is the known Corynebacterium diphtheriae, unknown Corynebacterium diphtheriae from the patient sample, and this is from the known Corynebacterium diphtheriae positive control and the known Corynebacterium diphtheriae with the negative control. Okay, if there is a line in the test, that means it is positive. If there is no lines, it is negative. Please remember and go through this properly. Okay, moving on from complement fixation test. Okay, before going to the complement fixation test, I would like to finish off the labeled reactions. Okay, the labeled reactions are in the form of spotters. Okay, here the labeled reactions are divided into ELISA, RIA and IF. Okay, here only for the ELISA we are going to provide the specimen. Okay, and this specimen is for all the three categories of ELISA: the direct, indirect or the competitive. Okay, what is the direct ELISA? The direct ELISA is to detect the antigens. The indirect ELISA is to detect the antibodies, and the competitive ELISA is to know the concentration of antigens. Okay, here you have to find out which type of ELISA depending upon the question. Okay, there will be a question. Okay, a scenario will be given. Based upon that, you have to know that. Okay, mostly the questions which is related to the antigens is always direct. Okay, and if there is a serum or the antibodies, it is indirect. And if there is a quantification, concentration, if the question comes, it is competitive. And here you have to know that the antibody is conjugated with the enzyme. You have to know this properly. Unless or until you know, you cannot answer. Which component is conjugated with an enzyme? It is antibody. Otherwise, the question can be different. Antibody is conjugated with what? Enzyme. And here, what is the colorless substance we are using? Is the substrate. Along with this, the color formation appears. Okay. How to measure it? By the color or the intensity of the color. Please remember this. Okay. Regarding the RIA, okay, what is RIA? It is a radio labeled immunoassay. And here you have to know about RIA is certain things. That is, you should know what is the isotope used is I-125. And it is very sensitive method. It can measure as low as 0.001 mg per ml. And it is one of the important methods used for the concentration of vitamins, hormones, enzymes, etc. But here, this also has the disadvantage. What is that? It is very cost effective, okay? And the shelf life of these components or to keep these isotopes is very difficult, and to disposable of this waste radiation materials also is very dangerous. Apart from this, this RIA has been replaced by the latest method called ELISA. Please remember, RIA is being replaced by ELISA. Regarding the immunofluorescence, okay, here we are having the direct immunofluorescence and the indirect immunofluorescence. Okay, this is actually, it's almost similar to ELISA, but here we are not using the enzyme. Instead of enzyme, the antibodies are coated with the dyes. And that dyes are called as the fluorescent dyes, and you can measure it using the fluorescent microscope. Okay, which uses the ultraviolet rays. Okay, so if the fluorescent means it is actually showing the light. That is, what is the principle behind that is, it absorbs the light at the shorter wavelength and gives at the longer wavelength. Okay, and here also there is a direct immunofluorescence and indirect immunofluorescence. Anything related to antigens, again, or the microorganisms, it is direct. Anything which is related to the antibodies or the serum, it is indirect. Even I have given some examples. Okay, like a rabies or anything, and here I have given serum. Apart from that, I request you to go for the self-study. I hope this video finds you well. Inshallah, hasbunallahu wa ni'mal wakil. Moving on from this, we have come to the complement fixation test. The complement fixation test, okay, this is also done for the syphilis, Treponema pallidum, and this is also for the sexually transmitted disease. Okay, here you have to know that why we do the complement fixation test is when the precipitation reactions or the agglutination reactions are not possible, we are going to do the complement fixation test. Here, certain things you have to know. What are the components in the complement fixation test? First of all, you should know a specific antigen, and we are adding the unknown antibodies. Along with this, we are going to add the complement. Apart from this, we are going to use the indicator system, okay? And here the indicator system is the hemolytic system. What is the complement? The complement is being prepared from pooling the 4 to 5 guinea pigs serum from the 4 to 5 guinea pig serum. And here the indicator system is sheep's RBC plus hemolysin obtained from rabbit. Hemolysin is antibody, that is the antibodies which are capable of causing the hemolysis, which has been obtained from the rabbit. Here, this is not going to be over here. Here you have to see whether the reaction is hemolysis or no hemolysis. Okay? If it is hemolysis, that means the complement is not fixed. Okay? Why it is not fixed? That means the absence of antibodies. Okay? If there is no hemolysis, that means the complement is fixed. That means the antibodies are present in the serum. Okay? Besides this, this too is used as a controls. This too is used as a controls. Okay? This is the positive control and this is the negative control. The positive control is, that is, no hemolysis, that means the complement is fixed. The negative control is hemolysis, that the complement is not fixed. Okay? This no hemolysis control is called as the antigen control. Okay? The control which shows hemolysis is called as serum control. Okay? But we are not going to stop here. The most important thing about the complement fixation test is the titration. You will be given the set like this and you have to find out whether it is significant or not significant. Okay? How to do this? Again, the universal value, the significant value here is 1:800 or above. 1:800 and above. So you have to see till the last tube where there is no hemolysis. Okay, and here the tubes are serially diluted and it is labeled as 1:100, 200, 400, 800, 1600. Okay, you have to see each and every tube. The first tube, no hemolysis, no hemolysis, no hemolysis, hemolysis. So the third tube is showing up to the third tube there is no hemolysis. That means what is the value here? 1:400. Compare it with 1:800. Okay, it is less. That means it is insignificant. Okay. Here we are going to go for the neutralization test. That is one of the important tests, and this is to find out the toxin neutralization of certain important tests. Okay. Here we are going to take the example as ASO, anti-streptolizin O. Here what we are going to do is we are going to subject its anti-streptolizin O, which is an antibody, towards the SLO, that is the streptolizin O antigens, along with the indicator here. Here it is RBC. Here we are going to find out hemolysis or no hemolysis. Okay. Here you can see this is no hemolysis and this is hemolysis. No hemolysis means it is a positive control and hemolysis means it is negative control. What is this no hemolysis means? That means the toxin is neutralized, and here hemolysis means the toxin is not neutralized. And this is used as a control, and this one is used as a toxin control, and this is the RBC control. Okay, and here apart from this we are going to have the serially diluted sample of the serum added with the streptolizin O antigen along with the indicator RBC. Then what will happen? Hemolysis, no hemolysis. So we are making a titer. So up to what titer it's going to be no hemolysis, we have to find out. That means the last tube which shows no hemolysis is the titer value. Here the significant value is 1:200 or above. So you have to keep on seeing all the titer values. See the first tube, no hemolysis. Second tube, no hemolysis. Third tube, no hemolysis. Fourth tube, hemolysis. So the third tube is the last tube which shows no hemolysis. What is the value here? 1:400. Compare it with 1:200. Okay, that means it is above. That means it is significant. That means the toxin is neutralized. Understand? You can remember only one thing here. It's very simple. That only the value of titer value of 1:100 is insignificant. All other values are significant.
We'll go.